Another case the state lawmakers working on involves the Zika virus, especially since Utah now has its first confirmed case of Zika. The Utah Health Department made that announcement this morning. News specialist Alex Cabrero is live outside the department to explain what this plan involves. Alex?
Deanie, state health workers here want to stress that even though there is a confirmed Zika case here in Utah, those of us who actually live here in the state don't have anything to worry about. The Zika virus, with its mysterious-sounding name, has always been a disease diagnosed in faraway places, but not anymore.
Utah has had its first documented case. It is a child between the ages of 2 and 10 years old.
Dallin Peterson is an epidemiologist with Utah's Department of Health. He says the child visited a country where Zika is an issue and had rash-like symptoms. However, he also says there is no need for the general public here in Utah to be concerned.
This child can't transmit it among other people.
Especially since the disease is carried through infected mosquitoes that aren't in Utah.
The main concern are pregnant women that are traveling overseas, and like you said, the infants with birth defects and microcephaly.
But some think it's not going to just be an overseas problem for long.
Experts fear that the virus will spread more widely to the United States, especially with the Rio Olympic Games on the horizon.
Last month, Utah Congressman Chris Stewart introduced a bill in Washington, D.C. to authorize using $2.7 billion in an Ebola fund for Zika response and preparedness.
Congress has already allocated funding to fight many of the world's infectious diseases like Ebola. And I want to make sure this funding can also be used to combat the Zika virus.
Now, health workers here in Utah aren't telling us what country that child visited or even what part of the state that child lives in. As for Congressman Stewart's plan, that is still going through legislation. Deanie?
All right, interesting case. Alex, thank you.